Dear students, welcome back. In the previous session, we have discussed about extrinsic finger flexors. Now in this session, we are going to discuss about the extrinsic finger extensors. As we know that extrinsic muscles are nothing but the muscles which are originating above the wrist joint, which has function at the fingers, that means on the hand, then it is called as extrinsic muscles. Okay, so these are the muscles which helps in extension of the fingers, then these are called as extrinsic finger extensors. The important extrinsic finger extensors are: one is the extensor indicis. This one is the extensor indicis, extensor digitorum, and the extensor digiti minimi. These three muscles helps in the finger extension. So what are the muscles? One is extensor indicis, and next one is the extensor digitorum, and extensor digiti minimi helps in the extension of the fingers. Now we will see their origin and insertion and its course, then we can easily understand the function of these muscles. Okay, now, so first we will see the extensor digitorum muscles first. So this extensor digitorum is originating from the common extensor origin, that is nothing but lateral epicondyle. So this is the extensor digitorum muscle, which is originating from the lateral epicondyle, and then these muscle ends. So all these three muscles will pass below the extensor retinaculum. We know that. So this extensor retinaculum will have 6 compartments. Through these compartments, these muscles have passed through and it come into the dorsum of the hand, isn't it? So the extensor digitorum, after coming out of this extensor retinaculum, actually this is the place of extensor retinaculum, afterwards it splits into 4 tendons. Okay, so each tendon will supply 4 fingers, the 2 medial 4 fingers. So the 4 tendons will supply to the medial 4 fingers, that is medial 4 digits. Okay, so once this tendon reaches to the proximal phalanx, the tendon for each digit divides into 3 slips. So here each tendon is going to divide into 3 slips. So if you take one tendon, so at the level of proximal digit, it is divided into 3 slips. Okay, so one is the central slip and 2 collateral slips. Okay, the central slip is called as central tendon or intermediate slip, which is inserted into the dorsal aspect of the base of the middle phalanx. So the central tendon is going to insert at the base of the middle phalanx. Okay, and these 2 collateral slips, this again reunite, these 2 slips will reunite, and which is going to insert into the dorsal aspect of the base of the distal phalanx. Okay, so this forms the dorsal expansion. So this forms the dorsal expansion of these tendons, which mainly helps in the extension of these interphalangeal joints. Okay, that means it forms an extensor expansion or extensor hood. Okay, so like this extensor digitorum gives 4 tendons, and these 4 tendons are going to insert on the medial 4 fingers in this manner. Okay, now we will see the extensor indices. This extensor indices is originating on the posterior aspect. Okay, so this muscle is a deep muscle actually. So like flexors, this extensor muscles also having deep muscles as well as superficial muscles. This extensor indices is a deep muscle which is present on the posterior surface of the ulna, normally below the origin of the extensor pollicis longus, and also it is originating from the interosseous membrane. Also some fibers are originating from the interosseous membrane for this extensor indices. This tendon joins the ulnar side of the tendon of the extensor digitorum. So this extensor digitorum is going to join the extensor digitorum tendon on the ulnar side, that is medial side of the extensor digitorum. This extensor indices is present, and it is finally getting inserted for the index finger along with the tendon of the extensor digitorum. Okay, and this one also helps in the extension of the index finger, and extensor digitorum helps in the extension of all the 4 fingers. Okay, next coming to the extensor digiti minimi. Extensor digiti minimi is also originating from the common extensor origin. This tendon of extensor digitorum for the 5th finger, so here you can see the 5th digit, so it is inserted through the dorsal digital expansion in the dorsal aspect of the base of the middle phalanx and the base of the distal phalanx. Here, so this tendon at the level of the proximal phalanx, it slits into two slips. Okay, these 2 slips are going to joining with the extensor digitorum collateral branches. Okay, and finally it insert into the base of the distal phalanx. Okay, so if you see the insertion, at the insertion of the little finger, it is having one central tendon. Okay, one central tendon at the little finger, and collateral slips of extensor digitorum as well as the slips of the extensor digiti minimi is present at the level of its insertion. Okay, so the action of this extensor digiti minimi is extension of the little finger at the interphalangeal as well as the metacarpophalangeal joints. Okay, if you see all these muscles are crossing the wrist joint also. So all these muscles are crossing the wrist joint. So these muscles are also having some function at the wrist joint. That means these muscles helps in a wrist extension also. Okay, and if you can see the actual actions of these muscles individually, the extensor digitorum is having individual function. That means this is the index finger. If you can see this tendon of extensor indicis passing medial to the extensor digitorum tendon, and it is having an independent action. So this extensor indicis is having an independent action over the index finger. So the tendon the tendon is having the capacity to extend the index finger alone. If you can see this little finger is also having the capacity to extend the little finger alone, but it is having some contractions, some action of extensor digitorum is also taking place in the case of little finger. In the case of middle finger and the ring finger, it is not possible of having independent action, because on its course, on its way, so each tendons are connected with some fibrous sheaths called as junctura tendinae. So because of these connections of these tendons is making all these tendons work together, okay, except the extensor indicis. If you can see this, the tendons are attached to only to the extensor digitorum tendons. If you see in the little finger, so the tendon is separately present here for the tendon of extensor digiti minimi. So these junctura tendinae is attached to the tendons of the extensor digitorum. Okay, so because of that reason, these two fingers, that is index finger and the little finger, is having some independent action. If you can see the independent action of these muscles because of these connections, so the maximum independence for the extension of the index finger is more, then goes to the little finger. So although it doesn't have some connection at this metacarpophalangeal range, but finally it is having some connection with the extensor digitorum. So there it may have some combined action with that of the extensor digitorum at this level. Okay, so next independence goes to the little finger and then the middle and ring fingers. Okay, this is the independence of their actions. Okay, and if you see the actions of these muscles, so we have seen the anatomical part. So these tendons causes extension of the metacarpophalangeal joints as well as the interphalangeal joints, isn't it? So if you see the action of this tendon, so when we see each tendon is divided into three slips, isn't it? So one is the central slips and two collateral slips. So what happens? So this tendon which is crossing at this wrist joint causes extension at the wrist. That one is very clear. And if you see this metacarpophalangeal joints, it is also quite clear, because so the central tendon which is crossing over the metacarpophalangeal joints over the proximal phalanx. So contraction of this central tendon causes the metacarpophalangeal joint flexion as well as the proximal interphalangeal not flexion, extension of the proximal interphalangeal joints is taking place. This contraction of this central tendon. And if you see this collateral slips which are getting inserted on the distal phalanx, at the base of the distal phalanx, the contraction of these slips is not enough to extend the distal interphalangeal joints. So for these muscles, it requires some additional forces. Okay, these additional forces is coming through the extensor mechanism. So these additional forces are brought by some of the intrinsic muscles which are getting attached to the extensor expansion, helps in the extension of the distal interphalangeal joints. So that thing we can understood by studying this extensor mechanism. For this extensor mechanism, the intrinsic muscles mainly helps in this extension are two groups of muscles, that is intraosteal muscles and lumbricals, which are getting attached to this extensor expansion, helps in the perfect extension at the distal interphalangeal joints. So in this, what we have discussed here in this is the three main muscles which helps in the extrinsic finger extensors are: one is the extensor indicis, extensor digitorum, as well as the extensor digiti minimi. All these three muscles helps in the extension of the metacarpophalangeal joints of the fingers as well as the proximal interphalangeal joints, and also which helps at the extension at the wrist. Okay, and so the distal interphalangeal joints extension is not that much effective by only these tendons. So for that action, it requires additional muscular support which is brought about by the intrinsic muscles. These intrinsic muscles are attached to the extensor expansion, which helps in further extension of the fingers. Okay, so that thing we are going to discuss in the next video, that is extensor mechanism. Thank you.